Hello and welcome to Sterilization Standards Unpacked, navigating Canada's dental guidelines, where we'll talk about the evolution of dental sterilization, the people shaping it, and the standards guiding it forward. I'm your host, Sarah B. Cruz, and in every episode, we'll connect innovation to intention, because progress in dentistry doesn't just happen. It's built through consistency, clarity, and care. Here, we'll explore the practices that protect patients, the standards that impact process, and the professionals who set the tone for excellence. Whether you're in the operatory, the sterilization room, or leading a team, this space is for those who believe that quality isn't a checkbox, it's a mindset. Sterilization Standards Unpacked, navigating Canada's dental guidelines, is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. So let's get ready to get dirty and go dental. Hello, bonjour, and welcome back to Sterilization Standards Unpacked, presented by Solventum. And today we are asking a question that comes up in every clinic. Why does dental sterilization feel so different? And hear me out. When we go to the dentist, like not even inside of a full medical facility where you're getting oral surgery done, right? We're just going into a dental clinic. It's already so different. I know as a sterile processing professional or a medical device reprocessing professional, I look at all of the picks and scalers and every single instrument shoved inside of that peel pouch. And I'm like, that is definitely over the weight limit, right? So there's something that you just can't unlearn yourself once you come into this profession, right? But at the same time, it's a different dynamic. In the same way that acute facilities kind of joined into that sterile processing aspect, dental is well into its evolution into streamlined sterilization practices. And I really want to take this episode to challenge the idea that there's differences, or they're just perceived differences. And how is Canada as a whole, as a nation, taking this opportunity to utilize all their different standards and processes and practices to create one way that we are seeing Canadian progress in dental sterilization? To help me with that, because I am not Canadian, I am American, and I'm thrilled to be hosting this because I'm learning so much about where we can grow to. I have our guest, Warren Hiller, who is a medical device reprocessing nerd. He's our MDR nerd, from team lead to manager to IP. He's been doing it for 25 years and making it look easy. Hey, Warren, thanks for joining us.
Hi, Sarah.
All right. And now Warren joins us from Alberta.
Yes, from Edmonton, Alberta.
Yes. And that's going to be an important note throughout this series, folks, because we're going to have guests come from all over the nation. Later in the season, we have someone joining us from Nova Scotia, another professional from Ontario. So you're going to really see the differences in provincial application of these Health Canada recommendations. Yeah, Warren?
Sounds good to me.
All right, perfect. So, Warren, the first thing we got to talk about is those autoclaves. Okay, so first of all, autoclaves in a dental space, okay? They look nothing like the big boys in our facilities, right? And I want you to just take me from the top of autoclave sterilization, our tabletop. I had one that I used to use, and we called it Big Bertha. And if you didn't release the steam early enough, she got very upset. Okay. So aside from the physical differences in autoclaving, what do you see as some of the key differences in just dental sterilization in general?
So other than the sterilizers and the autoclaves that we normally see, the difference there, which is big, you'll see often the ultrasonics won't be those big, giant ultrasonic devices like you see in the MDR setting. Often you won't see you'll only see one or two sinks as opposed to like the three sinks or the multiple bays of sinks like in the hospital setting. One of the big ones that you see in the dental facilities is it's a mental barrier, not a physical barrier. So the decontamination area and the assembly line for prepping and packing your instrumentation and that, and even into the sterilization, it's all open and exposed to the one space. So often you still have to implement the one-way workflow process, but you don't have the physical barriers. You just have like something like a mental or a visible barrier. When the pandemic happened, we started putting plexiglass dividers up to separate the areas a little bit, but it's still a one-room. I always called it the one-room schoolhouse.
I like that. I feel like you should get that on a shirt. I like that.
The one-room schoolhouse and just an open MDR. Yeah.
Yeah. I like that very much. And I relate to what you're saying because I started in veterinary medicine, and that was very much the case. We had these mental dividers that you knew these were the spaces you were working. You had to still put on PPE. You had to make sure you still lube the instruments, remove bioburden. But then there would be like the plexiglass in between, you doff. And so I can relate and see exactly what you're talking about. And really, it just makes me think of the fact that the differences don't mean less. They quite literally just mean different. And even though you have these small teams and these small spaces, you still have that big responsibility with the same expectations. So how do you navigate that in that type of space? How do you even go about training in that space?
Well, the dental industry often, still to this day, like they've started investing in hiring MDR techs. I know a lot of dental facilities have MDR techs in them, but a lot of them don't. And they have a dental assistant where the dental assistant is certified and trained as a dental assistant, and they have training in sterilization. So they are often put into that area for the sterile processing. My facility, we are an oral surgery center, but we still do some dental related activities. We made it a stance that we were only going to hire people who have been certified sterile processing technicians and either have the CSA CMDRT or the HSPA CSCRT certification.
Oh, interesting.
Yeah.
So it's that required certification, that dynamic, right?
Yes, 100%. And, that could be a part of the new guidelines that have been coming out, that a lot of the facilities are going to start looking at getting more of the certified trained individuals to exclusively work in, because the new CSA guidelines and standards that came out in 2023 actually require us to have training, competencies, and even certifications. All my staff, when we get inspected, which we were just recently inspected about a year or so ago by the various governing bodies, the College of Surgeons and Physicians, the dental College of Dental Surgeons, and I forget the whole name, CDSA, I think it is, and Alberta Health Services, all of them asked for the certification of the staff. They want to know the people that are actually working in the department are trained professionals and know what they do and have competency training and reevaluation training and assessments to make sure that they are following what they're supposed to be following.
So those are some pretty bold statements from these governing bodies and all the letters you just said. So let's unpack that a little bit, okay? I have a lecture that I like to give that talks all about procedures and how regulations and guidelines make it into your facility policies, standard work, best practices, and all that jazz, right? So it kind of sounds like that's what's happening similarly in this space, right? So it comes from Health Canada, right? That's pretty much your FDA, right? Take me a little bit about what Health Canada does in this space.
So Health Canada oversees a lot of the medical devices, kind of like your FDA in that aspect. In the US, they oversee all the medical devices, the chemicals and solutions that we would be utilizing in our facility.
Oh, okay. Yeah. So it is very similar to the FDA in the fact that it's that federal foundation for medical device classification. And I really like how it actually defines that Spalding category, the critical, the semi-critical, and the non-critical references in the CSA that it sounds like a lot of the facilities are trying to adhere to, right? So talk to me a little bit about what the CSA Z314 is. What's that all about?
So CSA is the Canadian Standards Association. It's basically like an independent body that is integral and integrated within Health Canada. It does all the research, it does all the studies, it finds all the studies to create and formulate recommendations and guidelines. In 2023, it created it for all healthcare facilities, and it basically tells you the Spalding's classifications, how to handle the sterile processing from point A to point B from start to finish, high-level disinfection, and it basically gives you a guideline for all the techs to follow.
Oh, that's interesting. I love that. You know, it sounds like they're giving you a quality management system. So would you say that the difference, because it just had an update too, like it wasn't always the 2023, there was a 2018. Would you say that that QMS, that quality management system, is the biggest difference between those updates?
From 2018 to 2023, there's quite a few updates. The quality assurance is a big update. From the 2018 to 2023, the water quality has also become a huge topic. So normally the changes are very minor, but those are some really big changes that have come through in 2023.
Oh, I like that. And with a good quality management system comes a good competency verification, right? I can't have one without the other. Yeah.
Absolutely. Like the quality management system, the quality assurance, the competencies, the reassessments, and making sure that, all of the paperwork is right and done right and correct, and that you even have it, because not all facilities did all these checks. They didn't check the water. Some of them didn't even clean their sterilizers. And there was, as you always saying, if there's no document, you didn't do it. So if there's nothing to show that you did it, can you say you did it? So it looks like the CSA implemented it so that the checks and balances are there.
Oh, and okay. So, and then when we were coming on to the show, I had accidentally mentioned that you're from Montreal, and you're like, no, I'm from Alberta. And I said, oh, okay. And I didn't really understand the impact of that until you had shared that there's differences in how the provinces do it. So it gets even more granular. So take me a little bit through that from Alberta.
So in the grand scheme of things, it's the CSA, and then each province, the Alberta Health, Ontario, Quebec, they all disseminate that information, and they just insert it into their structure and their guidelines. Typically, they can't go less than the CSA, but they will tweak the wording and format it in the structure that goes inside their current frame, their structural framework of the recommended guidelines from these governing bodies, the Alberta Health, the College of Surgeons and Physicians, and so on. And they will just insert it where they think it is supposed to go. And, and then from there, it's up to each facility to update all their information, review it, even compare it to CSA and say, is there anything different? And then as well, compare it to their actual facility and translate it. Like, can this actually function within this facility?
Oh, that's very helpful, actually, because now I'm thinking about it, and it sounds like these guidelines, they sound like guidelines, right? They sound like the opportunity for other provinces to transition to the CSA-based guidance, right? So you're saying this is the minimum, and then they're adding on top of that, yeah?
Essentially, and most of them want to try and keep it as close to a minimum as possible because they want to set that bar at such a pace that almost everybody can achieve it if they just adhere to it. They don't want to set it too lofty of a goal. And every so often, they might make some changes like we did from 2018 to 2023, make a couple changes here, make a couple changes there, based on whatever the standards and the guidelines and the recommendations have adjusted with the time. So that's where you're seeing with the 2023, the changes happened, and then it just filters down into the Alberta and Ontario. And they want to make sure that, okay, are you using critical water in your final rinse phase? Are you doing all of these things that, are just subtle tweaks to the past recommendations? And of course, when you put things off for a bit, that's when you see a giant leap. And then others, like the various facilities, will look around and go, oh my God, there's so much I have to change now. Well, that's when you need adequate staff to make suggestions.
Yeah, and when I was learning a little bit about Ontario standards, I almost got this feeling that they mandated every dental office to appoint an infection control lead. They started to really reinforce that compliance as a professional duty and not optional. And I really liked that type of approach with taking the expectations set by the, CSA and making it, well, best practices, right?
And that's exactly what it is. It's best practice. And even though it's recommendations and guidelines, there's a best practice that is that minimum concept. And should we have an infection prevention control officer and assistant? Absolutely. Should you have an MDR team that is sufficient numbers that can handle the workload? 100%. Should there be a hierarchy where you have like a team lead or a supervisor that can help, and even like who handles it as an educator, who can help these other staff members disseminate the information as it comes out the pipeline so they can make any necessary adjustments and changes, and they're not left in the dirt going, what just happened? Why is there so much changing? Right? So.
Right. Yeah, no. And you said my favorite word, educate. And I get really excited when we start talking about that. So we're going to use this time to take a small break and hear a word from our sponsor and to do our process unpacked. We'll be right back. It's time for Practice Defined, a quick pause to unpack a key term shaping dental sterilization and safety. Let's talk process challenge devices. A process challenge device, or PCD, is a test system that represents the most difficult items to sterilize in a load. It challenges the cycle by verifying that steam or gas penetrate completely to even the hardest to reach areas. Under CSA Z314, a PCD containing a biological or chemical indicator is used to confirm each load's effectiveness and document process integrity. In dental practice, it's the evidence that clean is truly sterile before instruments reach a patient. That's Practice Defined. Now that we're one term closer to excellence, let's jump back into today's episode. Hey, everybody, and welcome back. How was that first ever process unpacked? Okay, so these little breaks are going to be very important throughout our podcast series, right? As you've heard in our first episode, they're really going to be that opportunity to help us understand some foundational concepts that it's going to help us move the conversation along as well as the industry forward. And speaking of moving the industry forward, we are still joined by our special guest, Warren Hiller, who is taking us through the day in the life of an all-around MDR nerd who wears all the bouffants and talking to us about what the implementation of the CSA and the Health Canada recommendations and regulations have been like. Hey, Warren, thanks for sticking with us. We appreciate it.
Doing it.
Yes. So speaking of doing it, tell me how you guys actually get this done in the facility. We spent the whole first half of the show talking about all the things we needed to do. Talk to me a little bit about what it's like with these small teams or these areas that need to balance the time, the workload, these new verification expectations with the 2023 updates of the CSA. Just take me through what that growth has been like.
So the growth kind of started during the pandemic. And, this facility is an oral surgery facility, but we were very grandfathered in and covered a lot under the dental program. So we had a one-room schoolhouse, like I said, that worked in a one-way workflow, and we had the decontam sinks. We had the plexiglass divider, we had assembly, our sterilizers, and then once it came out of the sterilizer, we let it cool down and sent it out all in one space. And, we had, at the time, 2 to 3 staff members, and we average anywhere from 15 to 18 surgeries a day per OR, 2 ORs running. And then we implemented a third OR to do pathology, which averaged around 10 surgeries a day.
Right, because what would make it better? Let's do a third OR. This is going to be great. Excellent.
Right?
All
Right. Exactly.
I'm excited to hear the scaling.
Yeah. And, we looked and we had 1 under-the-counter washer. We had 2 tabletop sterilizers. And my coworkers and I were working very late. And I said, things have to change. You want to make these changes? We need to upgrade our facility. And thankfully I have some very good proactive surgeons that are owners that go, well, okay, what do they do at the hospital? And then I proceeded to explain the differences. And I said, even if you get a chance that you're at the next scheduled appointment at the hospital, go check out the MDR and see how they are set up differently than us. And soon after, we got approval for a complete reno of our MDR space. And that meant having it just like the hospital, but a condensed size. So we have a decontamination area with hands-free sliding doors. We bought our adjustable 3-sink setup, just like you would see at the hospital. We got ourselves a larger ultrasonic. We still have our under-the-counter washer, but we actually got a pass-through washer and a pass-through window, just as the hospitals would have it, but just for the size of our facility. And then on the other side, we obviously have our assembly side, and we upgraded our sterilizers to a couple more of that type. I think at this moment in time, we have 4 gravity, we have 1 pre-vac sterilizer, and we also have a steam flush pressure pulse cassette sterilizer. And we have almost we got our productivity's gone through the roof due to the fact that we have so much equipment now than what we didn't have before. And we've even opened up into almost closely getting centralized with our instrumentation.
Oh, that's the magic word, centralized, right? And
yeah.
And that's just, can we just take a second? I don't know if I was the only one that took a gasp and clutched my pearls when you said we have a pre-vac sterilizer in a dental facility. I was
and there are facilities out there because they do have them. They're much smaller than a lot of the gravities, which are big, giant guys. But, as soon as I pointed out, hey, we can put all of these things. If you look at all of our MIFUs, the sterilization instructions and exposure rates, everything goes to that same number. So why do we have over almost 10 exposure cycles in our gravities and 1 for this pre-vac? And as soon as I said that, they went, well, let's just get that. It just makes the most sense.
Yeah. And, I think that there's a lot to be learned from just this type of dialogue that we're having, right? That, progress isn't something that we have to wait for. Progress is defined by how we practice, right? So it's empowering almost to see that these have rolled out and given MDR professionals the foundation necessary to make these strong suggestions and back them with standardization, centralization, and industry expertise. And that's phenomenal on my end.
It is really phenomenal. And, that comes with, by doing that comes with a challenge. That comes with more. You have to do a few things extra. So when this started happening, I was offered the role of, we call it a team lead. It is essentially the head of the MDR. And with that came responsibilities of, we mentioned earlier, the quality management systems, the competency training, the continual education process, the assessments, and making sure that all the paperwork is current, factual, updated, and routinely done and followed. So we make sure that we can track all of our sterilization loads, the lot numbers, as well as, anything new that comes in. I have to sit down and I have to give a competency or an educational training seminar for that item. If it's a new implant kit, a new surgical instrument, a new way, a new process, we have to explain it to my techs so that they are understanding of what it is, so that they have the best information and full concept of what's going on, so that they can do their job to the best of their abilities.
And what a passion statement, right? Like, you can feel just the level of commitment that's in that space, Warren. So that's a great statement. I love that. And as we start to bring this episode to a close, it really demonstrates why standards matter. And they matter because they make our work predictable, repeatable, and frankly, even more trusted, right? When a single clinic can speak the same language of quality, the patients may not know it, but they hear it and they understand it too, just because of the outcomes that they're going to have, the positive patient outcomes. Yeah.
Absolutely. And with those uniformity, I would call it, as you start going to these other facilities, they all will have almost identical processes, so that the patient, at the end of the day, we know that is our bread and butter. That is who we have to put our passions and drive into to ensure that they get the best possible outcome from point A to point B the minute they walk into the facility. So that obviously includes medical device reprocessing. And if you aren't taking into consideration and care and concern for that patient and following those standards, recommendations, and guidelines set forth by these governing bodies and the CSA, you have to look in the mirror and go, what changes do we have to do to make sure that the patient and their safety is paramount and essential.
Well said. Well said. And, if we circle back to the beginning of this episode, when I asked, what is so different? Honestly, the passion's not different. It sounds like the only thing that different is the facility itself, and the CSA and Alberta, British Columbia, Quebec, Nova Scotia. Everybody's got their different provincial outlines, and then you have Health Canada coming in to really make that umbrella that everybody falls under. And then on the top of that, the CSA constantly making updates. So really, this excellent, phenomenal episode. Warren, thank you so much for taking the time to break down all the acronyms, the ABCs and LMNOPs, and I couldn't have had a better person to do that. So thank you again.
Thank you, Sarah. It was fun to be on here.
All right, everybody. I'm your host, Sarah B. Cruz, and with that, we're going to ask you all to keep fighting dirty and solving with momentum. Thanks for listening to Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines, where we connect innovation to intention and recognize the progress driving dentistry forward. Every conversation here is a reminder that progress doesn't just live in policies and products. It lives in people, the professional choices we make, the standards we uphold, and the care we deliver every day. If today's discussion inspired and motivated you, share it with your team and keep the conversation going. Sterilization Standards Unpacked, Navigating Canada's Dental Guidelines is supported by Solventum, creating smarter, safer ways to deliver healthcare and advancing the future of dentistry through innovation and education. I'm Sarah B. Cruz. Thanks for joining me, and until next time, keep fighting dirty and solving with momentum.